morning, friends. I'm your faculty, Dr. Atul Sharma. In during this week, we study about the pre-medical examination of athletes, about the warm-up, about the cool-down, and conditioning of the athlete. So they all are interrelated, and so on our lecture first, we discuss about their examination, the importance of the examination, and the various parts of the examinations. So first, let's we start with the pre-participation examination of the athletes. We will discuss under following headings: significance of physical examination, types of physical examinations, importance of physical examination, and drawbacks of the physical examinations. So everything has a plus point also, so there is some negative points also. So we will discuss all these things during these lectures. So what are the significance of the medical examination of the athletes? So, first and foremost, the injury prevention or early detection of injuries and make the sports safe and safer. There are lots of people who are scared about so many games, and when they come to know ki yes, ki they are not so serious and there are no serious injuries, uh, and if serious injuries occur, it's very minimum or very rare in few of the games like boxing. If somebody wants to participate, he is already scared ki my body will be condemned, my facial and face will be damaged, and so many other things. But as you go through the injury portion of the boxing or some other games, you see there are very less number of serious injuries, very less, like concussion, loss of life, loss of limb, and these injuries are generally not very serious and very rare. So, from where we come to know about these data? So, these data comes from our regular medical examination, through regular medical examination, and with the help of these examination, we can diagnose things early and we can save the that athletes also. And second thing is that monitor the injury patterns while during medical examination, either which kind of whatever type of medical examination, we come to know the injury patterns of that particular game. Like soccer, we come to know which part of which type of injury is more common. In the sprinting activities, hamstring injuries are more common, or in the combat games, which kind of injuries are more common? It's during the competition or during the uh, conditioning time. So we also know about their injury pattern also, and with the help of these we can do research work for the betterment of that particular sports, for the betterment of the athlete. We can do research how to enhance performance of that athlete or that particular sports. And simultaneously we also come to know about the risk factors of the games, and where we can save where we can, if we put some safeguard, so we can avoid those injuries. So uh, medical examination is very crucial and very important for any games. So there are three types of medicals. First is periodic medical examination, second is pre participation medical examination, and the third one is post participation examination. As the name uh, automatically signifies periodic, after a period. Generally, it's once in a year or twice a year. Pre participation, just before the any major competition, and post participation after every competition. So, periodic medical examinations. Periodic medical examination is a kind of a thorough medical examination, and it generally occur during the off seasons. And there is off season, and every sporting body has its own uh, performer, its own format, and there is no common consensus about the medical examination pattern of the uh, periodic medical examination. These medical examination or format depends upon the country, clubs, and the types of sports. Like in European countries, ECG is mandatory part of every medical examination. They don't want to uh, cardiothoracic examination or cardiovascular examination. The basic thing is ECG. And in the Southeast Asian countries where the cost factor is quite high, so they do selective electrocardiography or ECG. So it depends on the country, it depends on the how rich that uh, governing sports body is. So there the periodic medical examination is generally conducted during the off seasons when the season is finished and the new season is about to come. So and the pre-participation generally start with the beginning of the season to rule out injuries in the athlete, to monitor injury. If the athlete is suffering from some injury, whether how is he progressing, how is it injury, whether at what time he will be able to participate in his next tournament, and for the research purposes. For the post participation, if like some competition has just finished, so if that athlete or the part of team has suffered from some injury, so uh, their initial in the screening and their monitoring has to be done. So what are the procedure for medical examination, and what are the part of medical examination? Generally the entire the various sports body they have different pattern, but in general the common sequences remain like which they follow is history of athlete, the general physical examination, musculoskeletal examination, cardiac assessment, then the physiological test, and the lab investigation. Lab investigations and physiological test comes under human performance lab, and the cardiac, general, and physical and the history it will be done by the medical setup, and the both these are located in the uh, medical area of or the medical examination setup or the health club health facilities of the that particular club or the hospital. So what do you understand about by the history of the athlete? History is not about the illnesses. It start with the at what age he has started playing, at what age he become a amateur or he become a professional athlete, and when he started taking his game seriously, whether he earlier he was playing some other game and now he is shifted. So there are so many things which have to be recorded. So his training history, so his current sports history, and how many tournaments and what was his earlier performance was be noted. According to that, the level of athlete and the training and the physical fitness of that athlete can be uh, monitored. Then about the acute illnesses which he has suffered during last 1 year or during that period, the previous medical examination, previous periodic medical examination or previous prior participation medical examination, and this current medical examination like fever, diarrhea, or any other uh, illnesses, or any if he had some trauma during last game, whether it's a very minor trauma or it's a major trauma. So whether he's recovered from that or is still having some issue while practicing. So if there is any recent history of travel which can be monitored, so he can be monitored for the acute illnesses like the uh, infectious jaundice or the infectious hepatitis or infectious diarrhea or gastroenteritis, or as a, whether he has taken some vaccine or not. So all these things has to be recorded. Plus, if he has suffered some close ones loss under the uh, or he has suffered some monetary loss or uh, uh, so it comes under the psychological trauma or a major setback. Major setback, like he has lost his last game with a no voice. So that's a major setback for a elite athlete, or whether he has undergone some major surgery. So these things comes under recent history. uh, so first is training history about himself, whether he is a vegetarian, non-vegetarian, he's a teetotaler or a occasional alcohol, or whether he consumes smoking, or for how many years he is playing, for how earlier he was playing kushti, now he's shifted to judo, or earlier he was playing boxing, or earlier he was playing field hockey and now he is shifted to the football, like so. And then the injury, acute illness, any psychological trauma, loss of near and dear ones, or any uh, recent uh, surgery like hernia, hydrocele, or fracture. So so under this topic we record each and every part of his illnesses or training part. So, under general physical examination, we do the general physical examination of that particular athlete. It start with the height of the athlete, weight of athlete, and then the temperature, whether he is having fever or not, where how much is his resting pulse, his uh, current pulse, all in the standing position, in the lying position, then the respiratory rate, and then the blood pressure in the standing and in the lying position. When then we do his other systemic examination. In the general physical examination, we also do to rule out the anemia, jaundice, or any clubbing, or any deformity, or then we start with systemic examination. Systemic examination is start with the CVS and respiratory system, and in this we do auscultation, uh, resting auscultation, and the after little bit of exertion. With the help of a stethoscope, we listen the heartbeat, we listen to the respiratory rate and the breathings, whether it's a vesicular breathing or some other kind of breathing, whether some it's a normal breathing sounds, or there is some musical notes are also is listening. So by this we can rule out ki, we rule out that he is not suffering from some kind of uh, asthma or some other lung diseases. And by the heartbeat we can rule out ki, we rule out ki there is no murmur, there is no clicks, and there is no abnormal sound is listening from the heart. And especially the murmurs. Then the systemic examination, we do the uh, palpation also and percussion also of the, we rule out any uh, organomegaly of the abdomen, like hepatomegaly, splenomegaly, or some lump of the inside the abdomen area. We can rule out the any kind of hernia, any kind or hydrocele, and is there any some lump is not there, and then we do the neural and scalo mm, neural examination and musculoskeletal examination, where we do examination of all the joints, all the bones, and the range of motion, and we ask him to walk with eye closed and with eye open. By that, we uh, rule out any major neurological deficit or any kind of proprioceptive deficit. So till now we have studied about the how the significance of medical examination, then why it has to be done, what kind of medical examinations are there, periodic, pre-participation, and post-participation. When the periodic medical examination generally conducted during the off season, there is no common favorite, and it depends on the country, clubs, and type of sports. And pre-participation generally do with the beginning of the season to rule out injury, to monitor injury, and for the research purposes. For injury and post participation for the injury assessment and research purposes. Procedure, there is no single format. History, in history we do the training history, sporting history, and routine history. Then the physical examination, cardiac assessment, physiological test, and lab investigation. The history we ask about as we discussed, and then the general physical examination, where we do height, weight, TPR, temperature, pulse, respiration, blood pressure, or palpation, percussion, auscultation, and the range of motion of the entire joint. So, in the next lecture, we will study about the rest of our medical examination. Thank you.